afternoon, everyone. We hope you all had a chance to visit the poster reception. And if you didn't, you can message those presenters and still visit their posters by navigating to the left-hand side of the menu. But now I have the honor of introducing our next two speakers who will be talking about Maine's governmental public health system StoryMap, an interactive hub for informing policymakers, stakeholders, and the general public. We're joined by Haley Privat, who is a research and evaluation coordinator at Portland Public Health, and Chris Lyman, who is a retired public health professional and volunteer. So I'll turn it over to Haley and Chris.
Wonderful. Thank you so much, Heather, for the introduction. I'm so excited to be here today with my friend and fellow public health nerd, Chris Lyman. And so I think we're just going to jump right in. So I know we only have a half an hour and I want to make sure that we hit everything today. So thank you all so much for being here today. Hopefully that means that you have some interest in Maine's governmental public health system, whether or not you're a part of it, looking to maybe be a part of it. And so I'm really excited that you all are here with us today as we review the product that we have prepared, which is Maine's governmental public health system StoryMap. And so today we'll be able to kind of give you a little overview of why something like this that really kind of supports kind of some shared understanding of what the public health system looks like in Maine, why it's important, and then kind of the journey that we took to build this product. And then we'll give you a little preview of the product also. I'm hoping that maybe we can launch one of our polls here. We kind of wanted to gather from folks if you have seen our story map or not. And so I'm going to launch that poll, I think, if Nadia can help me do that. And you should see that on the left side of your screen, I believe. And so if that the right side of the screen. Thank you, Nadia. Sorry about that. And so you should see that poll launch. And so we just wanted to get a sense of from who's in the room, if you've seen our story map today or before this presentation, if you've gotten a chance to look at it. So we have that launched. We'll give it a couple seconds. And then if we could see some of those results, that would be great. Awesome. Perfect. So yes, no, unsure. I wasn't sure if some folks have like, oh, I think I've heard of that. I think I've seen it. So it looks like we have, for the most part, it's looking like folks haven't seen it. So that's good. So I think we'll be able to kind of dive deeper into some of the content too. Nadia, if we could launch our other poll, our next poll. It's actually very similar to the poll you all saw earlier with Dr. Shah. Just kind of curious from of the folks who are in the room, how long you all have been a part of the Maine public health system. As you'll see in the actual product that we've created, we've tried to kind of touch on some of the history that is involved in our story. And so I know folks have been here maybe, quite a bit of time. I saw 40 plus on there in Dr. Shah's presentation. But whether you're new or you're a veteran, hopefully maybe the story map will teach you something about our history. So if we can show that poll. So we're looking 1 to 9 years. No, I was going like the decades here. So we have quite a bit of experience within there. So but it's looking like we have some newer folks to public health and folks that have been here within really the last 10 years or so, but we have some pretty long-term folks. Awesome. Thank you, Nadia, for launching those polls, giving us a sense of who's really in the room today, this virtual space that we have. I'm going to jump into a little bit of the background of our story map, and really the background as to why we created this story map. So really, we kind of start off. If you were to Google public health in Maine, you might be led in multiple directions. Our landscape is pretty unique here, and so if you were to Google it like I did when I was coming to Maine a few years ago, you'll see a lot of different narratives. You might be led to some boards of health. You might be led to the Maine CDC. Maybe some of our hospital partners and our hospital affiliations. You may be led to some of our nonprofit folks. Or you may be led to maybe even our local health departments or some of our public health districts. And so there's quite a vast landscape out there of what public health looks like in Maine. And depending on your lens and where you're coming from, and what you Google, you might be led in certain different directions. And all those stories are wonderful and full of history and full of service and good work here in Maine. But what we were seeing is that there really wasn't a centralized hub. There wasn't a central story where you could go and kind of get a landscape of what was happening here. And we know Maine is unique, and we know that there's a lot of different things there on the landscape, and it really was starting to lead some questions, though, of the who, the where, the what, the why, the how. And without that centralized story, you might be sent in a bunch of different directions and learn more about how that person or how that part of the overall landscape functions. But that could be very different from another part of our landscape. And so this kind of, no central story was leading to a lot of questions and a lot of different areas of where you could go. And it really kind of presented itself as a really unique opportunity to be able to share that story and present that story. And so looking more at the opportunity that we kind of had presented, or that we kind of had available to us. There we go. Apologize. So looking at the opportunity that we had through the NPHA infrastructure group, these infrastructure groups, which Becca touched on in her update, are a really unique opportunity to collaborate, to partner with folks across different organizations across the state. And it's a really unique opportunity to leverage different expertise, different resources, different partnerships, to kind of tell that story or to dive deeper into something that you might be interested about. And the Public Health Infrastructure Group exists just for that, really. It really focuses on the intricacies of Maine's public health system and public health funding mechanisms. And so when we kind of were talking about that a little bit, we were like, well, that's kind of the opportunity, isn't it? Like, isn't that the opportunity of focusing on all the different intricacies of what makes up public health in Maine? That's a really unique, interesting story right there, because we're different. If you're coming maybe from a different state, I moved to Maine from Montana. Montana was very different in the way that it's organized at a government level. And so when I came to Maine, I was looking for certain opportunities that maybe were similar to something that I was coming from. And I wasn't finding that because the landscape looked a little bit different. And so we decided that, really the purpose of the infrastructure work group was to really tell that story, and to really tell that story utilizing the voices that we had in that space from different organizations and from different perspectives. And so over time, we really we're trying to figure out more and more and drill down what was our need, what were we trying to serve, what were we trying to produce that wasn't already out there. And And how were we going to do that? We needed something that was going to be accessible to as many different populations as we could imagine. You know, we were talking about wanting to use this to, you know, teach people about public health. So it had to have some basics of public health 101. It had to have some basics around what does it actually, you know, so who are the players, you know, who are the people. It had to have some, you know, the ability to reach not only maybe a school and that type of audience, but also our legislators, or maybe our partners and our businesses, or maybe a new employee who was starting, who needed to know a little bit more about public health and what it looked like. We needed this tool to be able to reach as many audiences as we could, because we knew that there was this kind of this gap that needed to be filled around just the story of what public health looked like in Maine. And so we needed something that was accessible. We needed something that was going to be great for different learning styles, whether you were a reader or, you know, you wanted something visual. We wanted something that was going to be accessible and could change based on, you know, color blindness, or, you know, or have closed captionings. We wanted something that was engaging, interactive, obviously. We wanted something that could capture the mediums in which we tell our public health story. So, you know, audios and visuals and videos and pictures. We wanted something that could possibly hold all of this. And then something that was easily maintained and updated. Sustainability was a really big conversation that we had. And being able to not just create something and leave it, but create something that was as dynamic and engaging as our actual public health system here. And that's ever changing and dynamic. And we wanted something that would be able to reflect those changes. And so we went through a lot of different tools, right? So we talked a lot about different things that were available to us within the capacities of that infrastructure group. And so we had some folks that, you know, were really talking about different podcasts that they had heard, and things that maybe we could recreate. Did we want to do other presentations? Did we want to, you know, do, you know, a curriculum almost, and film little videos? And one tool that we kind of stumbled across a little bit was Esri's ArcGIS online. And I have to give a big shout out to the City of Portland's Public Works Department here, because they really have kind of taken me under their wing and showing me this tool and the capabilities of this tool, which then I took back to our public health infrastructure group. So this really has been a labor of love as we've learned this software and what it can do for us. But this StoryMap tool really allowed us to kind of take all of these criteria that we wanted to do, and the people that we wanted to be able to speak to, and how easy we wanted this tool to be. And it all came together in this kind of one package, and using the infrastructure group as the backbone to be able to look at our narrative. You know, there's a new change, or there's a new law, or there's something that maybe we need to edit this story map. We have a group that's kind of working to kind of cull that information from all across the state. And there's always new members added. So if you're interested, you should, of course, come join us. But I think it's a really, you know, this whole story map really is a product of a public health collaboration. And I'm really excited for Chris to be able to kind of go through the story with you now. So I'm going to turn it over to her, and I'll scroll through the story a little bit, Chris, as you go.
Okay. Thanks, Haley. It's been a real treat to work with Haley, and she brought so much enthusiasm to the process. And I want to say it was an the committee has been an interesting combination of people with a wide breadth of experience and perspectives on what public health is. And so we had particularly, I give a shout out to 3 old timers Nancy Berkheimer and Al May and myself, all of whom collectively had years of Maine CDC experience, so that we were able to bring institutional memory to what happened, including clarifying where our memories differed. And then we had this incredibly sharp committee members who would ask all these questions and particularly look at languaging and so on and so forth. So our vision is listed first in saying that we wanted to create a product that would actually cross and be available to different administrations, but not be controlled only by that administration to say what the story was. So it was fun to create the product. As you can see, the arrow is pointing to the vision. I'm not going to read it all. This is part of what I'm going to do, is do highlights simply to say, look at this. This is where you can see what we want to go with. But certainly we're talking about coordination. We're talking about regional approaches, and we're talking about accountability. We want accountability for decisions. And in fact, that's where we started with. We had to work a while to figure out that what the foundation was that we needed to start with was the governmental aspect of public health, which for many people who may be working at the local level, they may have no awareness that government is involved anywhere in what it is that they're doing. They may not be aware that the funding is public money, or that the decisions about what to work on are coming from a contract, for example. So if we can go, Haley, to the first section where we're talking about EHPS. Can we scroll down to that?
I'll scroll while you're going. I think there's a lag, Chris. So,
all right. So we basically imagine if everybody in Maine actually described the public health system the same way, at least with the same concept, so that the moment somebody hears, they hear repetition. And if they hear repetition, there's more likely that people are going to remain, they're going to be able to understand it better, especially with our legislators. So we decided we were going to talk about public health from the 10 essential public health services. And we took the brand new revision of the public health services that were listed, which places health equity at the center, so that it's not only talking about, and we can't read this from, you need to get up closer to look at what those essential services are. But the concept was, and what's happening at the national level is saying basically everyone in every jurisdiction should have access to the 10 essential services, should be part of what they're living with. It should not be something where somebody on one side of the mountain lives in a community that receives these services, and on the other side of the mountain, there's a completely different approach and those services aren't available. Rather, we want to really have some standardization. So government is where it's at. I was recently thinking that, we have a lot of things going on where people are saying, you're not the boss of me. And so talking about the essential public health services really sets in stone the fact that the government is part of setting who decides Can you scroll down to the next graphic? So if you did not look at the essential public health services and this graphic, which are the foundational functional areas of what public health does, okay, you can wind up trying to describe public health by creating this super long list of topics. But in fact, public health has squeezed together. At the top, you have in the circles, everything can fit into those circles. They're the buckets where a lot of other topics fall in, but essentially there are ways to say this is what we work on. And these below with the foundation capabilities, this is how we do it. We deal with communications, we deal with emergency preparation, we deal with organizational competence. Who does what so that we can get things done? So let's go on. Once we covered the population health, the services and functions, and the equity, we're letting it go. We're just saying, that's it, let's move forward. Although we do reference money. And we, again, talk about both authority and enforcement. All right, can we go down to the state level?
I'm cruising, Chris. It'll go.
Yep.
It's just definitely
I know,
lagging.
I'm not, all right, okay. So why do we start with the state? Well, for a start, COVID revealed to a lot of our Maine residents that we had no network of local health departments. One does not exist across the state to deliver those 10 essential services. And with 483 municipalities, and I don't even know what the number of townships are, but a lot, plus tribal nations with separate sovereignty, the whole question of how would Maine organize its public health system is an incredible challenge. So basically, we have to start with what's happening at the state level, where we have the Maine CDC, which is officially the state public health agency. It is set in an umbrella agency of the Department of Health and Human Services, and that was formalized sometime in the 80s. I'm sorry, yeah, in the 80s. And then we also have the legislature with the DHHS Legislative Committee. So there are three sets of deciders at the state level, formally in governmental terms. So they have a big say. Okay, now we're going to move on to the sub-state level, because then you can get really talking about what's happening structurally. In 2007, we actually had a public health work group that defined and placed into law a description of public health infrastructure that up until then we did not have. There is no single section of our legislative laws that even lists all the public health services and programs in one place. So, for example, you wouldn't think to look at the Healthy Beach programs, which is in DEP, but yet it's an important program. But we did finally, after long discussion, develop and identify a regional approach where we defined 8 districts plus 1 tribal district. The 8 districts are bounded by county or multi-county boundaries. The Wabanaki Health District is defined not geographically, per se, but it includes members of all the tribes in a sovereign public health system.
Just a quick note, you've got five more minutes, Chris, and that includes the question.
Got it. All right. So I'm going to go faster then and say that in the districts, we have a district liaison who is actually Maine CDC staff. We have a coordinating council made up of volunteer members from a variety of sectors. We have representatives from each of the 8 DCCs in the tribes, putting together, being a state coordinating council. And the role of the district coordinating councils is to, in fact, support coordination, collaboration, to develop a district public health plan, and basically communicate in 2 ways: disseminating information from the state downwards, and at the same time sending information upwards about what's working and what's not. We also have coalitions, many of whom are members of the DCC. Originally, we had healthy community coalitions funded from the state. Then we had Healthy Maine partnerships funded from the state, and that primarily focused on chronic disease and substance abuse. And then we, the HMPs were discontinued in 2015, but we still have coalitions that exist and continue. Finally, the most local level is that in our state constitution, we have a requirement that, and in the state legislature, we have a requirement that each municipality have a local health officer. And the local health officer has certain functions, and they can also be supported by a local board of health, who you are going to hear from next. I will stop there.
Thanks, Chris. I can lead us out then. And so we do have some plans to continue working on the story map and continue building the story map. And so those plans involve kind of building out what that local level looks like, can even more so possibly, looking at different boards of health and looking at that structure. Also looking to possibly do some, deep dives on some of the other, if it's non-governmental, who are the players at the local level. So we definitely, hope to continue growing the story map and continue adding to the story map as our landscape continues to grow and change, so that everybody can see themselves as part of the public health landscape here in Maine. And now we're going to get to dive deeper a little bit on a board of health. So that's really exciting with our next presentation. So it is 2:49, so we're right on the minute. So thank you all so much for being here.
Any questions?
Yeah, are there any questions?
We'll take one quick question, and thank you, Haley and Chris. This was great. Was anyone missing when you developed the story map, and who do you still need feedback from?
Yeah, definitely. I actually think, even so, again, the story map, I think, is an iterative process, and it's an iterative product. And so I would say, we definitely want to highlight more of the local players and what that's looking at. Even after we debuted this, we had a really great meeting and got together and actually added more to it. So and because some of that local perspective around boards of health was missing, and so we added that. And so I'm trying to think specifically who we are looking to engage with. Chris and Heather, if you want to jump in at some point. But
I would say one of the main differences is whether we're going to continue the theme by working with municipal government, because there's a lot of conversation to be had just with what towns can do to impact local health,
yeah,
versus what's called community health, and community organizations, which may or may not include anybody who is defined by geographic boundaries.
yeah.
That's one of the things municipalities do, is they have boundaries.
Yeah.
And so what happens in them is something that they can work on, but they don't have to address an entire region. But we also want to hear what you think is missing.
Yeah. Yeah, and so we'll end on that, Chris. If you head to the StoryMap, there is an option for feedback. And so we would love it if folks could take a look at the StoryMap and offer your feedback, knowing that we definitely want to continue to grow and add to this. So please take a moment to send us some information. And I think that's probably it. Thank you all so much.
Both. Thank you both again. And we will, if you stay in the session, we'll put a link to the StoryMap in the chat so people can visit it, but it's also on Maine Public Health Association's website too, under our member sections. So we are going to take a quick 1-minute break as we transition to our next presentation on South Portland's Board of Health. So stick with us and we'll be right back. Hello again, and welcome back after that brief pause. We're excited to continue talking about public health infrastructure and boards of health, and we will be hearing about the kinetic value of community networks to move beyond programmed powerlessness and improve local public health, the experience of South Portland's Board of Health and Human Rights Commission. And I'm joined by Pedro Vasquez, who is a member of the South Portland Human Rights Commission, Tara K. Pelletier, who is a member of South Portland's Board of Health, and they'll be joined by Bridget O'Connor, who is also a member of South Portland's Board of Health during the Q&A. So thank you all for being with us. I will turn it over to Pedro and Tara.
Good afternoon, everybody. It is a distinct pleasure to be with you today to share our experience of what it was like, as that very lengthy title is describing, our experience in moving forward beyond what we see as a programmed powerlessness that is everywhere. It's insidious and it affects all types of agencies, all types of entities, and most importantly, all types of individuals, where we kind of internalize this idea that we are unable to make change in any significant way And so once you get beyond that program, Powerlessness, it becomes just a cherished experience, or at least it has been for me. And so, as Heather said, I'm joined by my esteemed colleagues and dear friends, Tara Pelletier, Bridget O'Connor, and Becca Bolas. And so, Tara, take it away.
Thank you, Pedro. Next slide. As Pedro said, we are really excited to be here with you all today and share what we have done in South Portland. Neither Pedro or I have any conflict of interest or any disclosures to share with you today. Next slide. So first, we'll do some introductions of who currently sits on both of these bodies. So currently on the Board of Health, Becca Bolas, who is the current chair. There's Bridget O'Connor, who is vice chair, myself, and Barb Skelton, who is a non-voting member and currently the LHO. Pedro?
Thank you. And so I'd like to share with you the composition of our Human Rights Commission, and later we'll talk about the deliberate manner in which we put this group together. You'll see that we have folks from all walks of life, right? So there's myself. I serve as the chairperson for the Human Rights Commission. It's been a distinct honor for me to serve in that capacity. My dear friend and sister, Colleen Jones-Turner, who does end-of-life care and very much in touch with the cosmic aspects of being a human being. Christine Dobson, who is an educator in our community. Jenny Perkle, who is a community leader and organizer. Sayali Robles, who is an artist and also shares my heritage, which is that of the Taino people. We were the people of first contact when European so-called explorers came across the Atlantic. My dear friend Brendan Williams, who is a disability advocate and is currently running for a seat on the city council. Also my dear friend Joe Barkley Roy, whose work is to work very, very hard to elect women to positions in office. Dan Ahern, who is the current chief of police in South Portland. Milan De Veda, who is also our planning director. Stephanie Weaver, who is our human resources director, rather, in the city of South Portland. And then Tim Matheny, who is the superintendent of schools. Next slide.
So the overall goal of this presentation is that we would want to share with you essentially the state statutes around local health officers and Board of Health. We wanted to give you show you the road of creation for both of these entities, the Board of Health and the Human Rights Commission. We wanted to give examples of accomplishments that both bodies have accomplished in the short amount of time that we have existed. We want to share perhaps one of our proudest accomplishments, which was a shared collaborative effort between the Board of Health and the Human Rights Commission. And that was the presented and approved declaration and resolve that racism is a public health crisis. And then finally, we want to end with some actionable items for you all to bring back to your communities and hopefully leave a minute or two for some questions and answers. Next slide. So we'll start with the state statutes. So as was conveniently referenced by Chris in the previous presentation, in the state of Maine, there are statutes that basically allow and outline that every municipality in the state shall employ a local health officer, or LHO, who's appointed by those municipal officers of that municipality. And this person could be in a part-time, a full-time position, or even a volunteer. They could serve in other municipalities as that LHO. And they are qualified for this position based on education, training, or experience in the public health field. And often this LHO may serve other city roles or responsibilities. Duties or responsibilities of the local health officer really kind of fall under 4 categories. And examples of that would be reporting communicable diseases. And again, as Chris outlined in the last presentation, that really they are functioning as this bridge of bi-directional information sharing, both up and down, relaying information both to the community and acting as a resource, but also presenting that information received from the community and percolating that back up the chain at a county, district, and state level, including the infrastructure of the CDC. And also sharing that information from that infrastructure and from the community to city leadership. They also are responsible for receiving and investigating complaints regarding threats or perceived threats to public health and public safety. And they would gather that information and then present that back to city leadership. Examples of that may be unsafe living conditions, hoarding, filth, illegal dumping, and then they are also responsible for enforcing public health and safety laws. Some examples of those may be bed bugs. It could be brown-tailed moth. There are numerous that they would be responsible for enforcing, along with other city staff. And then the statute regarding the Board of Health. So any municipality may appoint, in addition to the local health officer, a Board of Health, which would consist of 3 members. Members would include 1 physician and at least 1 woman. This body or Board of Health would serve as an advisory body to the local health officer, but they also could respond to requests from the City Council and then make recommendations, as long as those requests fell under the purview of the duties of the local health officer. Both of these positions are a 3-year term. Other than when the Board of Health is initially established, it has a staggered starting term so that they would not all finish at the same time of 1, 2, and 3 years. On the bottom of the slide, there's a reference, and in the handouts, there is also more information and detail about both the local health officer and the Board of Health. And there's actually pretty substantial information on the Maine Gov site regarding LHO training as well. Next slide, please. So the road to creation. So I'm going to talk about our path as the Board of Health. So really prior to the fall of 2017, the duties of the LHO were primarily managed by the deputies in the fire department. After that, a designated point person who happened to also be a full-time fire department employee took over the LHO role. What seemed to be fairly obvious after a 1.5 years in that position was that the needs and the caseload that he was receiving really was significantly more than what the 8-hour position allowed for. That feedback was given back to the city, and the city staff and city council heard that feedback. And in response, a former city councilor proposed a workshop to hear more information and different perspectives about how the city could respond to the demands and the needs of the city. So with that workshop, those perspectives were heard. And ultimately, it was decided after reviewing what community resources the city had, the offerings that the city currently provided for, and budgeting. And it was decided to create a Board of Health instead, to help as an advisory body. So within that 6 months of getting feedback, it was workshopped multiple times. It was approved, and then an ordinance was passed. And then fast forward to December of 2019, and 3 members were selected from an applicant pool of 9. And the first meeting of our first ever South Portland Board of Health was held in January of 2020. And please note that was 2 months prior to the COVID-19 pandemic arriving in our state and country. So our first order of business as the Board of Health really was to help the city reflect on that feedback that came up the chain from the LHO regarding the need for more support to handle the needs and the caseload. So what we did was we reviewed the feedback from key department leaders, including public safety, the fire chief and the police chief, the general assistance office, human resources, health inspector, code, and we elicited additional feedback from the superintendent of schools, school nursing, the senior steering committee, and human resources. And ultimately, the board at that time felt that there was a substantial gap in identifying really what the needs were of the city and what community health issues we were facing as a community as a whole. Thank you. Next slide.
So I'd like to discuss with you this journey that we've been on in creating this road forward for our Human Rights Commission. So essentially, it began in the aftermath of the murder of precious George Floyd. There was a lot of sentiment in the community that we needed to do something. And there were a lot of ideas about what we could do in response, but essentially there were a lot of phone calls. There were some meetings on my back porch, as it were, just regular citizens getting together and talking about it. And there were certain key people in the community who kept bringing up this idea of perhaps the Human Rights Commission would be the way forward. And that included our current mayor, Decca Delac, our former city councilor, April Carricchio, my dear friend and sister, Margaret Brown-Lee. In those days, it just seemed like a flurry of activity between all of us, going back and forth with emails. There was even some chats over social media that transformed into us getting together and talking about it in a serious manner and researching other municipalities that had gone through this process and established human rights commissions. We spoke with some lovely folks down in Melrose, Massachusetts, who gave us a lot of guidance into what we could expect and some of the pitfalls that could present themselves to us. And we then engaged with city councilors and city council, the city attorney, and we worked through a structure, a composition, what we wanted, what we didn't want. We created an ordinance that ensured that the Human Rights Commission would be viable for the future. And because we understand that, political winds change, and the reality is that, 10, 15 years down the road, that may not be politically desirable to have such a body that engages with marginalized communities in such a way, and kind of creates this space where we can have direct and real conversations with the power structure. So one of the things that we did was ensure that in order for the Human Rights Commission to be dissolved, it required a supermajority vote from the city council, which is very unusual. And we went back and forth with Corporation Council on that one, and we were finally able to make that happen. There was a lot of support for this little fledgling thing that we created. I got to tell you, there were state legislators in the room. There was a lot of young people in the room, talking about like high school kids, middle school kids. Everybody wanted to be involved. And in fact, this was the time when our city council meetings had first switched over to Zoom. And we learned later that if that meeting, if those series of meetings had taken place in a physical setting, we could not have accommodated the amount of folks that showed up to voice their support, which was very encouraging to those of us who we're working very hard to make this happen. The in the aftermath, there was some opposition. There were some conversations that were taken out of context, as these things, sometimes are. And there was some friction with the school board going back and forth. And then there was another section or a cohort of community members who voiced some pretty strong opposition to the work that we were putting forward. And, what we found was that once we met with those folks and we engaged with those folks in a thoughtful, deliberate way and heard them out, we found a lot of commonality. And in fact, some of those community members who they weren't exactly against what we were doing, but they had some reservations. Those folks are now some of our strongest supporters, which is really, really interesting to see that evolution take place. Next slide. Oh, I should talk about the funding of the Human Rights Commission, right? Because without the money, it doesn't happen. So the first year, it was very interesting because you talk about having the right people in the right place. At that time, we had the police chief who had just started, Timothy Sheehan, who is a very good friend of mine for a number of reasons, but I really have a lot of respect and admiration for the man, because in the midst of this very contentious and, difficult time in the aftermath of George Floyd's murder, he came forward and he said, I think that it would be a good idea for us to fund this Human Rights Commission with our police overtime budget. So while people were screaming about the headlines of defunding the police and what that really meant and how scary it was, we took a deliberate approach and we took a thoughtful approach, and it happened in our community for the betterment of our community. And then our city manager, lo and behold, was due a merit increase, and he turned around and he said, I'm just going to forego that, and let's put that towards the HRC's budget, which really it's such an example of people in power and who have the ability to move things, to make things happen in a real way, not the cosmetic stuff, the lip service that you hear about, doing something tangible and real and making it happen. And so because of that way that we structure that we have the power structure right in our Human Rights Commission, that's arguably is one of the reasons that it even came about, because we have the police chiefs, the superintendent of schools, the director of human resources, folks who really run things and can make things happen. Next slide.
Thank you, Pedro. I always love hearing that story. And I too share that there's lots of what feels like synchronous people in the room to make things happen for the city of South Portland, even from the Board of Health perspective. So now we're going to share some of the accomplishments that each of our groups have had, and we'll start with the Board of Health. So the last thing that I left off in my previous slide was really talking about that first charge that the Board of Health was presented with in regards to commenting on the position of the local health officer and the 8 hours potentially not being, or the feedback that the 8 hours was not enough to meet the needs and the caseload of the local health officer. So as I referenced, we got feedback from key leadership and elicited our own. And then essentially the board met and we came up with the recommendation that there really was a gap, a significant gap in systemic data about our community. And we recommended that a formal independent assessment be performed by also known as a community health needs assessment that would actively engage the community in helping us get some of that much needed data. We would then use that data in addition to data from previous community health needs assessment at the state and county level to make further recommendations. And we are proud to announce that that is underway as we speak, and we'll be wrapping up after the new year of 2023. And we'll use that information to present to the city and help focus both city and Board of Health efforts and to prioritize area of focus. The second item that I want to talk about in regards to our accomplishments is supporting the LHO and the city in regards to the growing homelessness crisis that we are still facing. So essentially on a monthly basis, which is how we held our meetings, we would elicit feedback from the LHO, who is also co-involved with a project through grant funding to the fire department that was providing direct services to both our domestic homeless and our asylum-seeking new Mainers. With that feedback, we would try to bridge resource gaps. We would also try to garner community awareness and engagement, and we did so by organizing and participating in a site visit with city leadership, the LHO, and board members. And we also elicited support for some media coverage of this homelessness crisis in our community. The third item that I want to talk about is some COVID funding recommendations. After we received some grant funding, we were asked to weigh in on how to allocate $35,000 to our community. And we ultimately opted to encourage continued infrastructure to support homelessness and allocated funds both to community paramedic outreach and hygiene supplies for the city and personal care packages and provisions directly impacting our homeless neighbors.
Sarah, you've got about 5 minutes left.
Okay, thanks. Community Sharps program, we were able to quickly pivot and take advantage of a program with the Public Health Program of Opportunity Alliance and able to implement that after that recommendation was approved for safe Sharps disposal in our community and get those implemented and collaborate with our Parks and Recs department and maps are pending. Next item. And then we were able to quickly pivot after our LHO role was absorbed by our current code officer in helping establish and share information regarding prevention and treatment regarding rodents. Pedro?
Thank you. And likewise, we'd like to share some of the activities that we have been able to put together for the community. And so, for example, soon after we were formed, we were given the responsibility of being able to participate in the budgetary process for the municipality, which is unheard of. So the entire Human Rights Commission receives the proposed city manager's budget at the same time that the city council receives it for review and also for comment and recommendations using a DEI lens. Next item.
Wow.
We've also established a stream kind of program where we provide unique and authentic opportunities for students and families, particularly folks from marginalized communities. And just to give you a taste of some of the things that we're doing, this year we are sponsoring an activity where we're sending some plants up to the International Space Station, partnering with some of our high school and middle school students. Next item. In addition to that, we have coordinated and celebrated and observed Juneteenth and the Indigenous Peoples Day holidays in our community, which had not ever happened before and has been received with such love in our community that it's just really a joy to be part of that. We're also now actively involved in the comprehensive plan, which of course is something that's required by the state legislature. Every city has to have one, and ours is looking forward to what our city is going to look like in 2040. And so I, as the chair of the Human Rights Commission, have the privilege of sitting in that committee and being actively engaged in that process while receiving the feedback and input from my community. And as well, we have meaningful engaged with the asylum-seeking community. We've spent a lot of time at the hotels, holding listening sessions, understanding what it is that they need, and coordinating with the multiple agencies that have responded and being part of that effort. as well. Last year, we took part in the tree lighting ceremony, which was a really big thing that happens in our town. We all meet in the middle of our town. We have this little park. It's beautiful. There's a pond, there's a gazebo. And last year, we made it a much more inclusive celebration. It wasn't, so much a Christmas themed celebration, but it included all of the human traditions. And as well, we worked together with the Board of Health to put together and present this resolve to our city council, declaring that racism is a public health crisis in South Portland. We worked together so many times, and we worked independently to obtain and disseminate data from across sectors, which demonstrated how these inequities that are systematic and structural in nature are really responsible for the racial disparities that we see. We were I have to give a lot of credit to Becca, because it was such an inclusive process, and all of us were coming to this table with a different perspective, a different lens, and she was so patient and ensured that each one of our voices was equally represented in what we finally put before the city council's consideration, in which they actually did vote in. You can see a timeline there as to all the meetings that we held and how unintimidating that process was. We had community involvement. We had involvement from the business community. It was really one of the more engaging and inclusive processes that I've been the honor of being part of.
And we've got 1 minute left. Sorry.
Cool. I'll be really quick. So with respect to these action items, the reality is that you can do this in your community. You can make your community better for everybody. And it just takes getting beyond that program powerlessness, right? So earlier there was talk about moral injuries and how moral injuries affect your ability to navigate the world. And so it is a very difficult way or a difficult process to overcome. But once you overcome that program powerlessness and understand that you do have the power to do this, and you don't have to necessarily be super selective about who's in the sandbox with you, right? So if you're the kind of person that likes to only listen to folks that have, initials after their last names or a certain level of education, throw that out the window. Listen to the people in your community. Listen to everybody, because you have something to learn from everyone that you meet, and that's the reality. You don't have to be an expert. Just stay curious and engaged and willing to learn. Everybody's path is going to look different. That's part of what this whole thing is. But you can come together and learn what your community needs to be a more equitable, healthy, and welcoming place. And so I'm so grateful to be with you today. And really, if you'd like to reach me or Becca, those are our emails posted on the screen, and I'm pretty easy to reach. So if you have any questions or just want to chat, reach out to me. I'm always available. Thanks so much. Really appreciate the opportunity.
Thank you, everyone.
Thank you both so much. And as I said earlier, we try to jam what could be days-long conferences into 30 minutes. So we appreciate it. And unfortunately, we won't have time for questions because we need to set up for our next session. But there were several that came through. So if you asked a question, I encourage you to reach out to Tara, Pedro, or Bridget, or Becca through the conference platform. You can ask questions that way or contact them by email. Don't forget to take the evaluation. We will be back at 3:30 with our last session of the day on large-scale vaccination clinics. So thank you all so much, and we'll see you back here in a few minutes.